Can I avoid knee replacement surgery? Very common question I get to hear in my clinic is, can I avoid knee replacement surgery? Knee replacement surgery is done when there is total and complete destruction of knee cartilage and meniscus and there is damage to the entire of the joint. Knee replacement surgery basically changes the surfaces of the knees and makes the joint better as compared to a severely arthritic joint. So knee replacement surgery is a surgery which you cannot avoid. You can postpone the surgery by means of taking intra-articular injections, physiotherapy, NSAIDs, painkillers and other therapies. But you cannot avoid knee replacement surgery in the long term. Thank you.